we already have the potential for 2 applications for mHealth in South Africa, besides the applications on PMTCT. Now, it seems to me that we can't, every time we have a new programmatic intervention, develop a new mHealth strategy for that intervention. And that is the challenge with scale-up. We need a whole system solution, and I think that's why I agree fully with this particular quote. Certainly for South Africa, having a program-by-program intervention is not sustainable, because we have the same community health workers essentially going to the same households to talk to the same people. And another anecdote, in March this year, I went to visit one family as part of the TB outreach program in a township called Umlazi in KwaZulu-Natal, just outside Durban. In this family, there was a 65-year-old blind lady. There was a 30-something-year-old HIV-positive man who was on treatment. His 2 brothers were not screened for HIV or TB. When we screened them, one was HIV positive. He has 3, the household had 3 daughters in it. The one was the index patient we went to visit, who turned out not to be at home. This family commutes from northern KwaZulu-Natal to Durban. And they commute from where we had XDR TB to almost the center of Durban. So the index patient wasn't there. However, she had a sister who also had TB and was on treatment, and she had a 3rd sister. Neither of these 2 young women were on family planning. Right? So you know this. Oh, by the way, there was one other brother who was a psychiatric patient. He had 2 bags of pills. He collects one bag when he's in northern KwaZulu-Natal. He collects another one when he's in Durban. And neither were complete. So he's not even compliant on treatment. This is, ladies and gentlemen, one household. Now, we can have one community health worker going there to look at TB, another going to look at family planning, another going to look at mental health, the psychiatric issues, et cetera, et cetera. But obviously, that is not sustainable. Hence, once again, we need an integrated information system that strengthens the health system. Now, my organization, which is the Department of Health, is no different to most public sector institutions, I would imagine, anywhere in the world. We are not innovators. We come late to developments. So the question is, if the primary engine for health system strengthening is the Department of Health, the Ministry of Health, how do you get them on board? And I think taking from a WHO publication of 2006 by Simmons, Fidjans, and Gurun, I think what they say certainly is true of my organization. And I think, therefore, to get public sector organizations on our side, on new technology, on new innovations, I think these are critical imperatives to figure out how to get around. So the member of the user organization, in this case it would be the Department of Health, must perceive a need for the innovation. So you must show that either to save money, to improve efficiency, or to improve specific outcomes, this would be useful. Secondly, the user organization must have the appropriate implementation capacity. I can tell you we currently and have had for a long time a routine information system that gathers data in an aggregate fashion from every one of our 4,000 clinics. We don't have the capacity in the national department to analyze that data. Yet we collect lots and lots of data from every facility every month. So if community health workers are collecting data using mHealth, the question is, who will use the data? Next is the timing and the circumstances. And I guess now with the it's almost like lemmings to the cliff, or the edge of the cliff. Now that we have 2015 looming, the time might be right. But the question is how to sustain the investments we make now beyond 2015. Fourthly, the organization must possess effective leadership and internal advocacy. You know, this thing about having champions within the organization that you're trying to influence. I mean, it's, in some senses, you know, we say it fairly glibly, but I certainly think it's true. And finally, the resource and user organizations are similar in characteristics and in close physical proximity. So I don't know if mHealthEd is going to create local institutions, but sitting in Ireland and trying to influence things on the ground might not be very easy, Tom. I'm not suggesting for one moment that that's what you're doing or that's what you're planning, but I think for most organizations, having a presence as close as possible to the ground is one of the, I think, and I agree with Simmons, etc., are one of the key ingredients for success. I think to add to that list from UNICEF, make sure that all programs are rooted in a local reality. These are not kind of things that apply only to mHealth and the use of cell technology. These are things that apply to scaling up projects, I think, generally. And I think understanding the local culture is important. To give community health workers in the Transkei in South Africa motorbikes may not be the best thing to do, for example. Now, the good thing about cell phone technology in South Africa, it has very, very high levels of penetration. So it's not an alien technology. To ensure that pilots and policy advice are substantively value add while being presented as good politics. Look, ultimately policy is about politics. It's as much as it's about technology and technical input, it's about how you sell a particular product. Start all pilots with partners who have voiced a serious commitment from the beginning. Now, I don't know, Tom, how you would define serious commitment, because I'm sure every partner, every organization you're a partner with at the outset tell you they're very serious about seeing this thing through. Increase multi-sectoral approaches to pilot planning and implementation. Now, for health, this is a no-brainer, that we need to have a multi-sectoral approach, because health is not just about health services or a health facility. Clear partnership responsibilities. You know, there are any number of projects that have failed because the Department of Health wasn't entirely clear what was expected of it once the project ended, or once the funding from the donor ended. And effective and realistic monitoring and evaluation guidelines. My sense in health is that even though I've given you a number of examples, only one of those examples, the Kenyan example, was able to show, from the examples I quoted in any case, some impact. If we don't show impact, you know, you won't have a case to make with respect to good politics. So impact is very important, and the ability to show that we can scale up that impact. So in conclusion then, my own view, and I'm a lay person on this issue, and the reason I became involved in mHealth and had to develop a draft strategy is because I went to my boss and said, I think we can use this for the HCT campaign, and I think we can use this for the TB outreach program. And she said, well, you can do whatever you want, but without a strategy, none of these things are going to be approved. So, and I can tell you how I went about doing it as well. I searched the internet. Right? And secondly, I circulated a draft to my colleagues in the mHealth community in South Africa to give me some input. So my own view, which is limited, I must confess, and which is biased by what I've read and the kind of small projects I've been involved in, is that there is sufficient evidence that we have a crisis and that we will never have as many health professionals as we need. I am convinced that with relatively little training and support, community health workers can make a huge difference. And I'm equally convinced that mHealth can assist in a number of ways. Real-time data on vulnerable individuals, real-time data on status of communities, and also adherence support, amongst others. However, if we cannot, A, integrate the use of mHealth into the service delivery platform, and B, scale up from pilots, I am not at all sure that mHealth will move from being on the fringes of the health system to being in the mainstream of the health system. Thank you very much.